Good afternoon, and thank you for joining us. As of 2 p.m. today, there have been 9,102 positive cases of COVID-19, including 396 deaths. Over 101,000 Missourians have been tested at this time. I want you to remember on the positive cases, that is a grand total again. I'll remind everybody from March the 7th, when this started, totaling these numbers up. Of the additional deaths today, I believe there was 19 deaths that were reported today. 15 of those come out of St. Louis County. Again, that death rate will lag on the cases for the weeks to come. I also want to remind everybody, it seems like every day when I walk in here and I do these briefings, we talk about these numbers. And I know on the news and the media, they play the numbers up and about that. But there's one thing that I've kind of caught myself and have to realize. Every day when I come in here and I say today there's 396 deaths. You know, sometimes we need to take time and just realize that those are real people out there that died, that lost their life, that have loved ones. And I think so many times we get wrapped up in the numbers that we don't pay enough attention to these really are people that affects people's lives and families' lives. So I want to mention that today, especially to the families that are out there that's lost a loved one and for the people across this state. Because regardless what the numbers are, comparison to anything else, it's still 396 people lost their lives to coronavirus on that. The other thing I want to give a little bit of a shout out today is Nurses Week. And it's what a better time than to congratulate, to recognize our nurses across the state of Missouri for what they do every day. And today, especially with the coronavirus out there and what they've went through over the last 60 days here in this state. But I just want to thank them for what they do every day. Every day taking care of people that in need, whether it's the coronavirus or whether it's other illnesses or whether it's accidents, whatever it might be. But those nurses are the front line of our healthcare system, and I just want to thank each and every one of them for the part that they play. As businesses reopen and Missourians return to work, we know that child care continues to be a concern. Under the Federal CARES Act, Missouri will receive $66 million in funding for child care assistance. Temporary changes in eligibility guidelines will now make it possible for more low-income Missouri families to qualify for child care assistance. The CARES Act Child Care Plan will also benefit children who are benefit children's care providers who continue to support the needs of working families during the COVID-19. Under the CARES Act, Missouri will also receive $1.5 million under the CARES Act to support food banks. These funds will be divided among Missouri's 6 regional food banks to help meet the needs of the growing number of families who now rely on food assistance. In addition to child care and food bank assistance, Missouri will provide emergency assistance through $1.8 million for the Victims of Crime Act grants. Today, Director Tidwell is here to talk more about these funds and child care, the food banks, and the VOCA funding, so let her talk a little bit more about those funds. Jennifer?
Thank you, Governor. I want to first share with you information around the Department of Social Services being able to support the Victims of Crime Advocate Grantees. So throughout the state, we have providers that support victimized Missourians, whether that be in child welfare cases and domestic violence cases, sexual assault, or other victims. We are pleased to be able to provide current grantees an additional $1.8 million in assistance. The other opportunity that we have to support these providers that clearly are, as we are seeing reported around the state, an increase in acts of violence, we will be seeking a waiver from the Department of Justice to waive the 20% match requirement for those grantees. And what that means is it will open up the door for grantees to be able to expend and use the federal dollars without having to have a match. And that's especially important as we know that grantees have not been able to receive the donations that they have in the past, as well as be able to document those voluntary hours. We plan on seeking that waiver immediately from the Department of Justice and immediately releasing the $1.8 million in funds to current grantees. Additionally, the Department of Social Services continues to work with communities to support basic needs and support Missourians re-entering the workforce under the Missouri Show Me Strong Recovery Plan. Our department has worked with SEMA and Feeding Missouri to secure $1.5 million of Missouri coronavirus relief funding for the purchase of shelf-stable foods. Food banks and food pantries continue to see an increase in the number of Missourians seeking assistance, and shelf-stable food items are in high demand. This funding will assist more than 1,000 feeding sites with meeting basic food needs in Missouri communities. Additionally, as the governor mentioned earlier, childcare continues to be a need for Missourians to return to work. As part of the CARES Act, Missouri did receive $66 million to support child care needs. Missouri's CARES Act Child Care Plan, which I'll share with you today, those highlights, supports Missouri's Show Me Strong Recovery Plan and child care providers impacted by COVID-19. Under the Child Care Plan, low-income families searching for work will be eligible for a 90-day child care benefit. Low-income families will be able to access this temporary benefit through December of 2020. Through August of 2020, all families with incomes up to 215% of the poverty level and with a documented child care need will have access to a transitional child care subsidy benefit. Today, families who previously did not qualify for a child care subsidy payment may now qualify. Many families eligible for this transitional benefit program will also see an increase in the benefit amount. Under a simplified two-tier structure, no family will receive less than 60% of the full child care subsidy benefit. Additionally, we need to make sure that families have access to child care providers. That's why Missouri's CARES Act Child Care Plan also supports Missouri's child care providers. Child care businesses are essential to the success of Missouri's Show Me Strong Recovery Plan. Under the Child Care Plan, child care providers remaining open to provide services to essential employees are eligible to receive a one-time payment. That payment will be based on the number of kids as far as capacity and range from $1,000 for providers caring for under 10 children to $7,500 for providers caring for more than 200 children. Additionally, licensed and license-exempt providers open during non-traditional hours, and those hours being after 7 p.m. and before 6 a.m. on weekdays, and also having weekend hours, are eligible for a payment of $100 per child care slot for the months of April, May, and June. Finally, for April, May, and June services, Missouri Child Care subsidy providers, so those providers who actually accept and receive subsidy through the Child Care subsidy program, will be paid on an authorized level of care instead of an actual attendance. Since Missouri pays child care subsidy providers in arrears, this policy will provide additional income to providers as they reopen their doors and operate under CDC guidelines. The last item on the child care plan is a partnership between the Department of Social Services and the Missouri Department of Higher Education and Workforce Development to work with higher education institutions to develop on-site child care programs. We will ask that as being part of a grantee, that these programs will provide for a certain number of child care subsidy slots as they're developed. Both child care providers and those families that might be seeking assistance can go to our website, dss.mo.gov, to learn how to apply for assistance or to click on our COVID-19 banner and get more information on the child care plan and the other items discussed today. I want to thank Governor Parson for his leadership and support. I also want to thank our Department of Social Services team for continuing to serve Missouri citizens and for creating opportunities to support communities with solution-based responses to basic needs such as food and child care. Thank you.
Jennifer, thank you much, and thank you for everything that you're doing to help for our kids in this state. And more importantly, by expanding this, we're going to be able to take care of the kids that need to be taken care of, plus we're all going to give an opportunity for people to go back to work to help with those babysitting requirements that they might all have. So I appreciate the work they're doing over there, and Jennifer and her team are doing. On Monday, I extended 4 executive orders through June the 15th, including Executive Order 20-06, mobilizing the Missouri National Guard. The National Guard has played a major role throughout the COVID-19 response, and they were very grateful for their efforts and their commitment to help Missourians during these trying times. As we move forward, the Guard will continue to play an important role in the recovery process. Today, Adjutant General Compton is here to give us an update on what the National Guard has been doing. General Compton?
Thank you, Governor, and good afternoon. I appreciate the opportunity to provide a quick update on the Missouri National Guard's current activities. Today, we have just over 1,000 soldiers and airmen in support of local and state agencies supporting the Governor's Show Me Strong recovery plan. We continue to provide logistics, support of critical items and equipment as necessary. An example of this is we're supporting the collection and redistribution of the decontamination of N95 masks. We're working with the Office of Administration and local agencies supporting the state workforce's return and reopening state buildings to our citizens by conducting medical screenings at 15 locations throughout the state. We're providing personnel, logistical, and transportation support to 6 regional food banks and pantries across the state that service St. Louis, Kansas City, as well as smaller rural areas like Maryville, Sikeston, Salem, and many others. We're also working with the Department of Elementary and Secondary Education to support school meal distribution to 10 separate school districts. And in coordination with the Department of Health and Senior Services, the Missouri Hospital Association, city and county leaders, and SEMA's Disaster Medical Assistance Team, we are staffing the alternate care site in Florissant with 32 of our medical professionals and have completed assessments of other sites with our engineers across the state. While our hospitals are in great shape and capable of providing adequate care and capacity, these additional assessments were completed as a contingency measure in the event hospitals may need support. We're thankful there hasn't been a need. Hey, I want to really emphasize I greatly appreciate the interagency teamwork that's underway. It's great to see local and state agencies, private businesses, and Missouri citizens pull together to take care of each other. While our Guard has a dual mission, one to fight and win our nation's wars, our Guard takes equal, if not more, satisfaction in fighting and winning our homeland emergencies. And frankly, it's because we're fighting and winning with our closest teammates, our family, our friends, our fellow Missourians. Thank you, Governor Parson, for your leadership and support for all Missourians. We know we are coming through this stronger together. Show me strong. Thank you very much.
General Compton, thank you very much for what you do and for what all our men and women do out there to protect our state, to protect our nation. Earlier today, I had a time to sit down with General Compton, and we was talking about actually the COVID-19, what they've done for that, but also making sure we're prepared for floods, also making sure we're prepared for national disasters that we had just the other night, and so many other things that they're doing to help with all of us at this time. And couldn't be more proud of the men and women that serve the Guard in this state and the leadership here in Missouri of what they're showing right now, and willing to go anywhere at any time to try to help Missourians that are here. So I really appreciate them today. And let me close up. Dr. Williams is also here today, so if you have some questions for Dr. Williams, he'll be available as we finish up here. I will say this time and time again. We are on the road to recovery, but we must continue to maintain social distancing. Just because things are reopening does not mean everything will go back to normal. We will get there, but until then, please continue to social distance. Continue to be proactive and use common sense. Continue to protect yourself, your families, and fellow Missourians. This is how we will overcome, recover, and succeed. Thank you, and God bless. Kelly?
Any questions for Governor Parson?
Hi, Governor.
Kurt?
The State Fair Board of Directors meets tomorrow. Would you recommend to them that they cancel the fair?
Yeah, I talked to some of that leadership this morning with the Director of Ag and Mark Wolf, the Director of the State Fair. We're going to really evaluate that come 1st of June. We're going to see what happens in May. Right now, we will plan like a plan A and a plan B to have the fair, or maybe a shortened version of it. But again, I don't think there's anything in concrete until we get a little closer to the 1st of June and see where we're headed in the state.
All right, thank you.
Yep.
The CARES Act funding that you mentioned for the child care facilities, when might those facilities expect to receive that funding?
Let me let Jennifer answer that for us. She probably know better about that than I would.
The funds are available right now from the federal government. So the programs that I talked about will be in effect May 1. So as I mentioned, we have on our website information for providers, and we'll be sharing that with stakeholder groups as well, where they can sign up to receive the funding that I've talked about. And as we receive applications for child care assistance, we'll be evaluating those applications from May 1 on based on these temporary changes in benefits.
You mentioned that there's some CDC guidelines that the child care facilities need to operate under. Are those any different than regular CDC guidelines for you and
No,
I?
I mean, there are, and again, we don't license child care providers. We work with Department of Health and Senior Services. We have information on that, but there are certain guidelines that that child care providers are asked to operate under, as well as if you look at certain county orders, they have certain requirements around operating. So,
are there any like sanitation requirements or anything additional?
I don't know them. I really can't speak to that as far as what those specific requirements are.
Is there an update on when Missouri can start to implement online purchasing of groceries with SNAP? USDA still says May to June 2020, but doesn't have a specific timeline.
So the update that I have from this morning is we continue testing with Walmart and Amazon, which will be the vendors who have online food purchasing eligible. And if everything goes well over the next few days, we're anticipating that will be available to SNAP households by mid-May, even late next week.
And once that program is in place, will it expire?
Right now, there's no expiration, so we've made a request of that waiver, and right now there is no expiration date for that waiver. Thank you.
All right, thank you.
General, whenever the state of emergency does expire, how does that affect your readiness going forward? And do you need that to have the same readiness you have now?
Yeah, hey, thanks for the question. As a matter of fact, I think it helps our readiness. Anything that we do, whether it be for our federal warfight or support to civil authorities, it enhances our ability to respond. Because what we do day in and day out is provide an organized, disciplined response. So it gives us a chance to reinforce what we do, whether, again, be for readiness to support our federal warfight. We can take advantage of the activities that we do in support of doing the efforts that we need to prepare our service members for support to civil authorities, and it enhances readiness across our force.
When it does expire, for example, does that still let you maintain the alternative care site if it's needed?
We could. We'd have to see how that shapes out. What we would probably do or see is that transfer to another entity.
Thank you.
Yep, thank you.
Any other questions for Jim? All right,
Thank you.
All right, Dr. Williams? Dr. Williams, the stats that are out now show COVID-like symptoms are going down as well as flu-like symptoms, and emergency department admissions are also going down. How can you separate at this point? Are COVID symptoms going down only because less people are going to the ER generally? Is there a way to tease that out?
Yeah, Philip, I think that one thing that some states follow, as you pointed out, as opposed to looking at testing, they look at ER visits and they look at what we call our influenza-like activity. Well, as we get out of flu season, that one becomes less helpful. We anticipate that you'll see ER visits actually starting to go back up, because one thing that Herb Kuhn and others, the Governor and I meet every week with all of the infectious disease doctors, and emergency room visits in general have been way down. And we think that's because people have been avoiding the ER because they're worried about COVID-19, which we don't think is a good thing. So we think the trends you're going to see is that you're going to continue to see, obviously I think we're out of flu season by now. I think you're going to see the number of people who present symptomatically in community transmission will continue to go down. And I think you're going to see ER visits going up in general as people get back into kind of a normal routine. That brings up one thing that I do want to say just parenthetically. I was talking to the pediatricians today, and they just asked me to remind parents that they very much would like to return to those well-child visits and seeing children again. And so as one thing we've tried to stress as we open up is that it's just there are risks to deferring care as well, whether it's going to the ER or going to your pediatrician. And so we very much encourage that. And just add to the governor, just as we start Nurses Week this week, just can't thank them enough. I started out as an orderly working in the Department of Nursing many, many years ago, and just can't thank our nurses enough. Thanks, Philip.
And then one other thing was, while the symptoms are going down, hospital bed capacity is also going down. And what's the reason for that? Yeah,
we looked at that, and I think part of that may be a reporting bias. As you look at COVID-19, we know that we have plenty of ventilatory capacity. We have plenty of ICU capacity. And so that may be a reporting bias because we have hospitals sometimes report as many as 160 hospitals report, and sometimes we only have about 100 report. So I again would look at trends there, that when we look at COVID-19, both our ICU capacity and our hospitalization capacity, and much of the modeling is looking at this, we feel like we have more than adequate for both of those scenarios.
Director Williams, can you hear me?
Yes, Crystal, I can. Thank you.
Director Williams?
Yes.
You mentioned the 60,000 testing capacity,
yes,
and we've talked about it for the last couple of days, but does that testing capacity take into account that labs are doing multiple tests from around the country?
It does. And so we break it out, Crystal, into two groups, our in-state labs, and then we break it into national labs. And so then your question would be, how would you know how much the national labs can do in Missouri, because they're national labs? And the way we do that to come to our capacity level is we both talk to them, and then we also look at weighted averages. And so we, about a week ago, we had to adjust for that because our averages of testing were going down because we had less symptomatic people. We had less sick people. So we do that by talking to those labs, and they give us their estimate of their capacity for Missouri. And that's when we look at the 17 or so labs, I'm trying to think in my head, breaking that down, but I think that's about like 5 or 6 of them: Quest, LabCorp, Jeanette Marks, those big ones. And I did want to follow up with you yesterday. I did the math, or at least Bill Whitmore did the math for me. We are supposed to get 200,000 swabs from FEMA either tomorrow or Friday, and 175,000 vials of medium.
The department did give us more details about the pallets from FEMA, so I appreciate that.
Sure.
I guess my question is that the state opened on Monday, but we're getting the pallets on Thursday. Is there a particular reason we didn't try to get a reserve of these materials before we decided to open the state?
Oh, we've been trying, we've been working on that. I mean, we call almost every day. But, I think if we had waited on that instead of, as the governor said, trying to do it on our own, I don't think that would have been the best strategy. We've learned through this, and the governor has reiterated this many times, that it's just really important going forward that Missouri develop its own capacity, its own wherewithal, its own initiative to go out and do that. So where we are today, largely because of that initiative, and what will be forthcoming from the federal government will just be added benefit.
Have we determined the 200,000 swabs, how long that would last the state?
It's a great question in that as we go forward, Crystal, the thing that we're adding now, and I know people follow the numbers, as the governor said, you've got to remember that we have a new part of our universe, which is that hospitals are now, as they do non-emergent surgery, are testing everybody for COVID-19. And so before they operate them, because you can aerosolize the virus and the anesthesiologists want to know. So again, as I've said now for a little while, you've got to treat the patient and not the chart. So that let's say next week you see this big increase in testing, well, that would probably most likely explain by the fact that hospitals are doing a lot of more testing on pre-op asymptomatic patients. If you didn't know that fact, you'd look at it and go, oh my gosh, we must have a whole lot more people in Missouri who are presenting with symptoms, and we don't think that will be the case, but we will watch it closely. Thank you.
All right. I just want to say one thing. Dr. Williams is just a heck of a nice guy because he always says you guys have great questions. I don't always think they're all so great. I just want to be honest with all of you out there. But anyhow, he's always a nice guy to always be able to say that. So any questions?
Governor, I realize we're here today talking about extra funding for child care facilities and daycares, but there are still instances where people who have jobs cannot find child care. Are there any additional protections in place for those workers in Missouri if their employer does say they need to come back to work but they can't find child care?
Yeah, I think we'd like to know who those people are and where they're at and see how we can help them with that. I think that's what all this federal money is for, and we're trying to provide those services. So I think it's a matter of reaching out to the organization, to Jennifer and her team, wherever we can to help that, Dr. Williams and his team. But we'd be more than glad to try to match somebody up with those care services because that's what it's for.
And there are some parents who are still expressing some concerns about the safety of sending their kids back to these child care facilities. They're concerned about them getting sick. What's your message to those parents?
Well, again, that's a choice the parent's going to have to make. If you don't feel comfortable putting your kid in an area where you don't think is safe, then I wouldn't do that. The reality of it is, that's parents need to take that responsibility. I'm not sure why any of us would ever put our children in harm's way if we knew there was an alternative, even if that means staying at home with them. So I think that would be the first way I would respond to that. And again, when it comes to the children, as we get more information all the time, I think it's really important for people to understand who are the high-risk people that the COVID-19 attacks. And we now know that much better than we ever did before. So we now know what the age brackets are. We know where those people might live. We know, such as the African American population, we know they're going to be targeted more than other races that are out there. You know that older people with underlying health conditions, a lot of factors we know now we didn't know 2 months ago. So I think, again, you got to keep that in mind. But again, the message I would have to any parent, if you don't feel like you're taking your child to a safe place, I wouldn't be doing it.
A follow-up to the State Fair question from earlier. Individual counties will also be holding their fairs or have their fair scheduled. Will they be left to decide to cancel or shorten theirs, or will they be advised to follow guidance from the State Fair?
There would be guidance. One, I think I want to be careful. I don't want to be misleading. Again, we're under social guidance for this 30 days, but outside is probably one of the better places to be. So as long as you do the social distancing and we keep the common sense in mind, I think all those things are fair. But it's challenging, too, when you go to a fair. So, again, everybody's going to have to adapt to something a little differently than what we did before this all started. But, again, that's why I say the first couple of weeks of May and this month will be critical to see really how things open up for June and July.
Governor, I just wanted to ask you the same question I asked Director Williams. Is there a reason why we didn't have a reserve of testing materials before the state decided to open?
Well, yeah, I think we're all trying, because it's not there to be had, is the number one reason. And since day one, we have fought that battle trying to get PPE gear in and testing. Every day, we're getting more PPE gear in. We're getting more of the testing material to get in, as you can see just by the amount of testing we are doing. And that's going to continue to go. But that's not isolated to Missouri. We're still fighting out all over the nation, and it's just a matter of the stock being, getting that demand that we can get it to us. But every day we have a goal in mind what that stockpile is going to look like for the state of Missouri at some point, and we're going to build towards that stockpile. But right now, it's a matter of just getting it on the front lines and making sure our hospitals, our health care, emergency personnel, everybody that has that gear needs it. But and the testing's the same way. It's the same way getting it in here. But I think when you look, when I talk to the federal delegation, when I talk to other people, and I think we all know this, there is going to be more testing available to the point where I'm not for sure you're going to be dependent on the state to give you the information of testing, because I think the private individuals in the near future will be able to get those tests at different sites that's not actually run by the state, whether that's a pharmacy, whether that's a hospital. You're going to see lots of testing being done that I don't know that we're going to have that recorded information like we once did.
Governor, is the state still purchasing PPE in the kind of volumes it was a couple weeks ago?
I know we are. I know we're trying to do that. I know we're getting more in all the time. I know we were getting a shipment of PPE gear in. Director Carson told me that earlier. I'm not sure exactly what that amount was. I know for the testing, we're getting more testing kits that are coming in, I think to the tune of, Dr. Williams, 15,000, does that sound right? Yes. On a truckload that's coming in this week we're supposed to receive. So all of that's building up all the time. And again, but we're really not at the point where, at some point we're going to have 30 to 60 days of stock for our stockpile, I think, and probably more leaning towards 60 days than 30 right now. But again, we got to get to that point, but we're a long way from building that up.
I'll take one more question.
Governor, Jackson County has indicated that it won't share its federal CARES Act funding with the city of Kansas City. Do you agree with that decision?
Well, I'm not sure. I know they're working on a solution up there. They're trying to work on a solution. Look, the county's going to have to share with the cities. That's what the money's for. I mean, for our part of it, we distribute to the county so they could distribute on the local level. So, but now Kansas City is totally different than most areas because you got Kansas City touching 4 counties, and that gets a little more complicated than St. Louis versus St. Louis City versus St. Louis County. So, but my understanding is they're working on that all the time. But look, that money is going to be shared throughout that community up there. One way or the other, it will. All right. Thank you all very much. Thank you.